I decided actually to become a gynecologic oncologist when I was a third-year medical student. My very first clinical rotation was obstetrics and gynecology, and at the time I had always felt a pull to women's health care but wasn't sure if it was the right specialty for me. I then spent most of my third year of medical school seeing if anything else felt more like home, and found myself working with a local medical oncologist who told me that not only could I be an oncologist, but I could also be a women's health provider, and I could become a gynecologic oncologist. And so I spent extra time in medical school rotating with gynecologic oncologists, really learning about the specialty. And I actually went to residency with the sole intention and purpose of becoming a gynecologic oncologist. There's lots of ways patients will end up coming to a gynecologic oncologist. Sometimes patients will see their regular OBGYN who will have a concern that there may be a cancerous or precancerous process, and they'll send them to our office. Sometimes patients will make their way to our office from their primary care physician who astutely has noticed that something might not just be quite right, and will send patients to us for even their preliminary workup. And sometimes people find their way to our office just because they need a little bit of extra hand-holding or attention through a really complex anticipated surgical process. You know, we really provide a full scope of care all the way from ruling in or hopefully out a cancerous process, as well as providing that extra set of backup hands for complicated surgeries that patients may have who have complex medical problems. Additionally, people may find their way to our office who've previously had a cancer, who need a little bit of extra TLC from their gynecology provider, making sure that we do what we can to keep their cancer from coming back.